Hello, everybody. This is Dr. Howard Robbins here on Functional Medicine with Dr. Robbins. And today we have Dr. Darrell Kilcup from Phoenix, Arizona, as our very special guest. And we're going to be talking about probiotics, specifically Doctor's Biome medical food, and how it's helped patients in his practice. Hello, Dr. Kilcup, and welcome.
Greetings. Nice to see you.
Nice to be seen, as I say all the time. At my age, I just turned 77, let the listeners know, and I still don't dye my hair, got a full head, and ozone therapy, I believe, helps that. But also, you have to have a healthy gut to have any benefits in life at all. But before we get started, Dr. Kilcup, tell us about your medical practice and what you do at your center. And then we're going to get into the nitty-gritty on how important probiotics are.
Yeah, thank you. I'm in Phoenix, Arizona. I am a chiropractor. I've been in practice for a little over 35 years. And for the first 25 years or so, chiropractic was what we did pretty much 100% of the time. And then functional medicine got on my radar, and I was very excited to learn about it. Jumped in with both feet, and for the last 10 years, I would say now my practice is primarily functional medicine. We see a lot of people with lots of chronic health conditions, everything from hair loss to Crohn's disease to thyroid issues to bizarre autoimmune conditions. It's amazing. Typically when you go to the doctor and you tell them, they ask you what's wrong. Most people will have one thing that they have that they want help with. My typical patient will have 15 to 20 different symptoms that they're dealing with, and that's normal for me. And we help them get better by finding the root causes. Sometimes those are, as we're going to talk about, problems in the gut, chronic infections that are causing all kinds of issues. Sometimes they're toxicities from mold to mercury. Sometimes they're nutrient deficiencies. It's shocking to me how in 2025, some things I find so common, like vitamin A and vitamin E and vitamin D and vitamin K and magnesium and zinc. And in almost everybody, it seems like we have some degree of deficiency in those things. And of course, the body's not going to work right if it doesn't have the ingredients it needs to do its job. So we do a lot of testing, we get a lot of data, and we help people. In the last 2 or 3 years, we've added hyperbaric oxygen therapy and red light therapy to our practice, and those have been huge helps as well for lots of those patients.
Well, you're talking about deficiencies. And if you don't have a healthy gut, you can't absorb all the nutrients that people are swallowing every day. It's key and essential. And we're living in a world where antibiotics have ruled. And even if a patient, by rare chance, has never had an antibiotic even once in their lifetime as a particular pill, they've eaten red meat or chicken that isn't organic, or farm-raised fish, or kosher or halal for that matter, and therefore they've gotten doses of antibiotics because they don't cook out. Even though people think they burn the meat, it's gone. It isn't gone. So people are walking around with horrible guts, not realizing that they have overgrowth of candida and overgrowth of harmful bacteria that they're ingesting every time they drink something or eat something each day. So it becomes a real problem that way. And having a healthy gut is something I need for my practice, because I destroy all bacteria in the body with intravenous ozone therapy. And that's what led me to getting involved with trying to find a probiotic that would really work. And the development of Doctor's Biome took actually 3 food scientists over about 4 or 5 years to be able to make something that no one in the world has been able to make, apparently, because most manufacturers said, oh, we tried it, can't work. Forget about it. Get out of here. And our third food scientist, Dr. Reza Kamari, with a PhD from MIT and a specialty, a food scientist, a specialty in probiotics. He's the one who figured, along with what we came up with from research on the internet, in our National Library of Medicine, the proprietary 15 patented strains of what's called next generation bacteria. These are bacteria that are created to survive the stomach acids over 90%. And then they're also called smart probiotics because they went to Harvard or Oxford and got a degree in probiotics. or or they were actually, there is such a thing called smart probiotics. They're actually created to stick to the wall of the gut. That's the simple way of saying it. They actually change their genetic expression when they reach the cell walls of your gut, and they kind of stick there and then work and play well with each other in the colon sandbox without overwhelming each other like certain probiotics might, that might still be beneficial if you were going to take one. So anyway, and then they had to have the right environment to live in, okay, which is what the organic vegetable juice is involved. 100% organic, because in Germany, it has to be 100% to call it biologique. Here in the US, 95% is okay by the USDA and the FDA, but not there. And this has German certification because it's sold all over the EU. So we have 100% organic juice that has the right pH for it to live in with prebiotics in it. And that's the key thing. It has the food that probiotics need to grow, okay, and thrive in. And so now they have the right food, and they're living from the time you ingest it, okay, all right, from ingestion to, from the time we make it to the time you swallow, all the bacteria living and growing in number every single day. And that's what makes it special. So the date on the bottle is not a date, is a date of manufacture, not a date of expiration. And within a few weeks, the 27 billion they start with are over 50, 60 billion. And within a month of that date, between 100 and 200 billion. And unrefrigerated, it won't go back down to 27 billion, meaning it ate all the food and it's not growing in number anymore. It's coming down in number for 3 months. So people, and they can't make it fast enough now. That's one of the problems the company is having. They have to make it, they have to make small batches, get safety approval from an independent lab, and then they finally are able to market it. So now everybody knows everything about the product we're going to talk about. And you found out about this. You started using it. Why don't you tell us how, what you've seen, what you've learned from it, and your feelings and opinions before we get into C. diff itself in more detail.
Well, C. diff is the reason I was interested in the beginning. You know, as a functional medicine doctor, my goal is not to treat an infection. It's to treat a patient and get them healthier. And the medical approach to C. diff, I think, is one of the dumbest plans of action that I can think of. You have a problem that's created because someone took antibiotics, and now you're going to treat it with an antibiotic. And the merry-go-round goes round and round, and these people can be infected with C. diff for the rest of their lives. And it is a major pathogen. It is extremely destructive. Not only is the bacteria itself a problem, but the spinoff of the toxins that the bacteria makes, the damage it has to the microbiome. So I am very interested in anything that can get rid of C. diff naturally without harming the patient. So I was very interested in your product when I was introduced to it, and we run stool analysis, we run organic acid testing, both which can pick up C. diff infections. And now, you know, before Doctors Biome came along, if I had a patient with C. diff, I was scratching my head and going, well, this is not going to be quick, it's not going to be easy, and I need to prepare the patient for a longer treatment. And we would usually get the C. diff under control. We'd usually get rid of it, but it would take 4 to 6 months of using different herbal formulas, different probiotic formulas. And, but your product came along, and it's now I see C. diff and I just smile because I know I have a treatment that's going to work. The patient's going to have an easy time taking it. And it's been great. It's worked very well for almost 100% of our patients. And I'm a big fan, and we recommend it in our treatment plans on a weekly basis.
Now, when you test for the toxin A and B in the stool, have you seen the patients have that eliminated?
Oh, yeah, routinely. My own mom had a pretty severe C. diff issue, and those cleared up. So, yeah, it's not been rare that it works. It's been almost 100% of the time. It's been fantastic.
Well, when you say 100% of the time it's almost worked, when that means in the 90 percentile, hopefully. What about the percent of people that it didn't completely get rid of it in? Um, uh, did you see improvement in those people?
Oh, yeah. Oh, yeah. They're feeling better. Their intestinal issues. I mean, we've had issues, everything from Crohn's disease, patients with C. diff, to patients with rheumatoid arthritis with C. diff. In all of those cases, even though the infection didn't clear after the first treatment, they felt a lot better.
Okay. Now, you also manage this nutritionally. You're giving them other supplements and things as well, I trust.
Oh, yeah.
Okay, and I just you should know I've always been I've rented space to a chiropractor most of my 52 years as a doctor. The last one just retired a year ago, so 51 years I've been renting space and sharing space with chiropractors because chiropractic is not just for back care. If you want to have a healthy immune system, you have to be in good alignment because the neurologic supply to every organ comes from your back, and it's not separate parts. Just mention a couple of minutes on the importance of chiropractic because I don't want people to think that that's less important in their health care.
You know, our bodies are not automobiles. They're not air conditioning units where one system is isolated, your transmission is isolated from your engine, from your brakes, from your fuel system. Our bodies are intimately connected, and everything affects everything. The dominoes that begin to fall in the gut will have dominoes effects all throughout the body in the chemistry. And the back is no different. The back encases the spinal cord and the nerves. And so the messages from the brain that travel down those nerves can be affected by pressure that's created by misalignments in the spine. And that information, if it's lessened to its destination, is going to have negative effects. I wish, even to this day, my own personal story is I had a very bizarre case of bronchial asthma from birth. By the time I got to 7 years old, I was missing half the school year. My dad took me to a chiropractor against my mother's wishes. It changed my life. I was able to breathe normally again. And, you know, the rest is history. I became a chiropractor because of the effects that the adjustment had on my respiratory system. But to this day, I wish there were diagnostic tests that I could run on a patient and measure that degree of neurologic interference that the spine was causing with them. That technology doesn't exist yet. And, you know, so what do? We take care of the spinal problems and see the improvement that they have or lack of it. But it's very complicated. You know, a patient that has a crooked back, mold toxicity, C. diff, you fix their back, their immune system is still going to be struggling because they got mold and C. diff, right? So sometimes these things are complex. They're not simple, but chiropractic is absolutely a gift and a huge help. And I'm very blessed to be able to do that for my patients.
Well, listen, there's no doubt that the body is a complex integrated mechanism. We have to have a healthy gut. We have to have the right nerve innervation. Everything makes a difference in the speed at which we can help people get well. I want to thank you very much for everything. I want people to be able to reach you. I'm sure they're going to have questions somebody may want to ask you. Could you give us your contact information, please?
Yep. I'm in Phoenix, Arizona. I do treat a lot of patients outside of the state via telemed and computers and phones. Worldwide, we help people. And my website is Daryl, Darrell Kilcup DC.com. If you just Google my name, you'll find plenty of links to my different websites and content. Our phone number is 602-864-0304.
Excellent. Thank you so much. I can't tell you how much I appreciate all this. Everybody, stay healthy, stay well, and we'll be back again on Functional Medicine here with Dr. Robbins. Thanks a lot, everybody. Bye-bye now.